Good afternoon, everyone. My name is Beverly Morgan. I'm the Director of Sales and Marketing here at Knollwood Life Plan Community.
Good afternoon. My name is Dre Howard. I'm the admissions manager here at Knollwood.
This afternoon, we want to invite you to attend our monthly webinar on Knollwood residency process. I hope that this information would bring some enlightenment, clarification, and some knowledge as to what it takes to move into Knollwood. Again, welcome and thank you for sharing your afternoon with us. I just want to share with you a few things about Knollwood, and then I'm going to go over the overview of what the agenda is going to be for today. Knollwood is a continuing care community where we sit on 16 acres here in Northwest Washington, D.C., right across from Rock Creek Park. Part of the eligibility process is that one would have to be 62 years and older to move into the Knollwood Life Plan community. But let me go back to the overview and the agenda as to what we're going to be covering today. One, we want to share with you the different levels of care that we offer here at Knollwood, what the move-in process is going to be like, and moving into Knollwood and independent living, which is where most people start out in a continuing care community, sharing some information with you about our assisted living services, and then sharing with you what our skilled nursing facility services are like.
And moving on, also, if you all have any questions, feel free to type them into the chat and we'll answer them closer towards the end of the presentation. But with Knollwood, we have 5 levels of care here, as you can see on the slide. So our the largest population here is going to be our independent living community. And that's for individuals who want to live amongst the community. Our independent living community is 160 apartments deep. We're on a beautiful campus and everyone here is very friendly, very polite. So anyone coming into independent living is gonna have a great time. We also offer assisted living, and that's for individuals who still want to live in an apartment and still have a little independence, but need some assistance with some of their daily activities. We offer skilled nursing, and within skilled nursing, there are several levels of care there. So we offer long-term cares for individuals who need 24/7 nursing care. And that's with anything from taking medications, bathing. We offer those services. We also offer short-term care for individuals who are coming from an acute setting who need short-term rehabilitation. And then finally, we offer memory care. And that's for individuals with dementia or Alzheimer's diagnosis. We can manage those people as well.
So one of the things that we find to be an asset to moving into a continuing care community is that no matter what your care needs are, we can solve those problems or concerns with you right here on the campus of Knollwood. And I want to share with you one thing that you may or may not know. Knollwood, although we offer 4 or 5 different levels of care, we're just one big happy family. All the services are in one building. We just serve a different section of the building for each area of concern of service that we provide. So I just wanted to share that information with you. But let's go over the move-in process. The move-in process is just as simple as 1, 2, 3, 4. The first thing we have to do is find an apartment that fits your needs and your preference. The other is complete the admission process. Completing the admission process is very easy process. We handhold you through every step of the process to make sure we do everything with comfort and ease. We coordinate your move-in date. That usually is done in collaboration with a move-in company. We find that to be a valuable asset for our older adults. It takes all the headaches and worries away. And at the end of the day, when you move in, it's like you move right back into your beautiful home, or your beautiful new home, I should say. The other is the staff and the residents here at Knollwood are so friendly, so kind, so compassionate, and so inviting. You feel like you're right at home on day number 1. That other thing is, welcome to Knollwood. You're here at home. We're excited to have you. And we have a welcome committee that's going to make you feel like you're right at home. I want to share with you the eligibility process. Again, in order to move into Knollwood, you have to be 62 years and older. The reason for that is we cater to an adult senior population, and we want to make sure that we are catering to our mission and our vision. The next step is, and the first step, the most important step, is that you have to get on our wait list. The wait list gives you access to all of our apartments, all of our monthly events. So every month we have either some sort of education opportunity that we do, community related opportunities that we offer. We also offer webinars and luncheons or dinners. Or we have community events where we invite you into some of the activities so you can engage with the Knollwood residents. It makes you feel like you're right at home. But to get on the wait list, let me explain to you what that entails. The wait list is a $5,000 fee. $1,500 of that amount is non-refundable. $3,500 of that amount is refundable if you choose not to move into Knollwood, or you find another location, or you just want to terminate the agreement. You would get $3,500 of that back. However, if you choose to move into Knollwood, $5,000 of that amount is all applied to your entry fee. So that's the first step. The second step is to find the apartment of your choice.
And then from there, moving into the next step of the process, we'll get into the application. So with the Knollwood application, it's actually very easy to read, very simple to fill out. There are several portions of it. If you look over to the left, you're going to see the demographic information. So with that information, it's just us getting to know you a little bit better. We're obviously getting your name, date of birth, any military positions you may have had in the past. Basically collecting a ton of information just to make sure that Knollwood is a good fit for you. You take a look on the right-hand side, that's where we're going to get into the financial portion of it to, again, make sure that you're a good fit here. And that's reviewed by us here at the marketing team. The first portion is going to go over any assets that you may have, such as investments or a home that you may own. We also collect information about your liabilities. So if you have a home that a mortgage that you're currently paying off, or any other kind of liabilities, obviously we want to know that. And then finally, there's one other portion that talks about your income sources. So if you have like a pension or anything of that sort, we like to get that information as well. So again, the application process is really simplistic, really easy to read. And if we need any additional information, obviously we'll reach out to you to acquire that info.
You may say, why so much information? And the answer to that question is we want to make sure that we have enough information to ensure that your assets will be able to sustain and maintain you throughout the lifespan of your stay here at Knollwood. It gives you the opportunity to make an informed decision as to whether or not this is financially the right place for you as you spend your senior years. So that's one of the reasons why we ask for a lot of information up front. It helps you make an informed decision. It helps us make sure that we can maintain you on every level of care, because as you know, Knollwood is a continuing care community and we offer several levels of care. So we want to make sure that when you need the different levels of care, your resources are able to support your care needs. But let me explain to you a little bit about independent living. Most people move into a continuing care community in independent living. And usually when people retire around about in their 70s or 80s is when they make the decision to move into a continuing care community. In that regards, they're usually still very vibrant, healthy. They want to move into a safe, comfortable, and a socially engaging environment where they are in the community of like-minded older adults that they can enjoy their senior year and their retirement years. One of the things I want to share with you about Knollwood's independent living is we have several different versions of apartments that we offer. We have a few small efficiency apartments. We have 30 different versions of a one-bedroom apartment. we have 45 different versions of 2-bedroom apartments. However, this information we can share with you, we can mail it out to you, you can come in and have a one-on-one consultation so that you can kind of gauge what apartment will fit your needs. If you look on this form, on the far left-hand side, it talks about the codes for the type of apartments. The 1-bedroom apartments are B apartments. The 1-bedroom, 2 bedrooms without a balcony are C apartments, and then the apartments with a balcony, 2 bedrooms with a balcony, are D apartments. Right next to that column are the square footage that are aligned with each apartment. And then the next column gives you a description of what each apartment entails. Then it speaks to what the entry fee is. We have a 45% entry fee. 45% means 45% of the entry fee will be returned to you if you decide to terminate or move out of Knollwood. You could also move in at a larger fee at 90% refund. If you decide to terminate or move out of Knollwood, you could get 90% of your entry fee back. The next column speaks to what the monthly fee would cost if it was one person moving into a particular apartment. And then the last column speaks to what the cost would be if 2 people were moving into an apartment. I hope that information is helpful to you. Moving on to the next level, we're going to talk about assisted living.
Yeah, with assisted living, that's just another level of care here. So a huge component of our community is assisted living, and that's for individuals who still want to live a part of our Knollwood community, but need a little bit more assistance. With assisted living, as you can see on the slide, we're offer 24/7 personal care. You get nutritious meals, housekeeping. We obviously give you a primary care physician. You have access to our dentist, and on the terrace level specifically, we have a lot of other nice amenities. We have a pool, we have a salon, we also have a convenience store. So still giving you that sense of a community while also giving you a little bit more assistance with the activities of daily living.
In assisted living, we have 4 different levels of care. Level 1 means someone is pretty much still independent. However, they may need some assistance with medication management and scheduling their appointments and overview with their physician. Level 2 may be that you need some standby assisted verbal cueing in regards to your activities of daily living. A level 3 indicates that 75% of your activities of daily living is provided by the Knollwood staff. And that level 4 means that about 75 to 100% of your activities of daily living is offered by or provided by the Knollwood staff. At this point in time, we'll be looking to determine when you and your family would feel like long-term care would be an option if your care needs extended beyond the needs in assisted living is able to offer. And Dre will share with you some information about long-term care here at Knollwood.
Yep, perfect segue. One of the benefits about living at Knollwood is that we are a continuum of care, which means that if for whatever reason things happen, you have a decline in your health, we can assist you once you get to the point where you may need 24/7 nursing care. With our long-term care is specifically geared towards individuals who still want to be a part of our community, and they'll just be in a different part of the building where we focus on that 24/7 care. So medication management, assistance with bathing, assistance with eating your meals. Another great thing about our long-term care facilities that we have a robust activities calendar. So even though you're a part of our long-term care community, you can still participate in a lot of the activities and still have that sense of community while you're here at Knollwood. Moving on to the next slide, you all will see that we are rated amongst the best nursing homes and long-term care facilities in the United States. We're ranked 5 stars for short-term care and long-term care, in addition to our skilled care and memory care units as well. So really great staff who's very dedicated to making sure we take great care of our residents while also still treating them with respect. We make sure that we take care of all of our residents' needs. And again, you can see by our ratings that we do a great job of that. Moving on to the next slide, with the skilled nursing and memory care, there is a process that we go through in order to get individuals to come to our facility. For long-term care, those are people who are moving within the continuum of care. So they have a decline in health and they need to make a transition. But as we mentioned earlier, we also have opened up our doors to the public as well. The idea is we want to be able to help and accommodate as many people as possible. So that's where I come in. I spend a lot of times going out into the community, building relationships with physicians and hospitals and caseworkers and social workers. So that way, those people who need those services in the community, they have me as a resource to help them transition into the Knollwood community. So that way we can offer the help that they need. We obviously do long-term care, but there are also individuals who may have recently had a fall, had a fracture of the hip or something of that sort, and they need some short-term rehabilitation. We offer those services to the community as well.
One of the things that I like to share that Dre has been a tremendous asset to connecting the community at large with the Knollwood family here. This concept of short-term rehab is something fairly new for us. However, it has been extremely successful. The average length of stay in our short-term rehab units is about 20 days or less, depends on how well you do with rehab services. And about 80% of all of our residents that come in for short-term rehab are able to return home to their previous living environment, stable, healthy, and safe, and back to their baseline. So we are proud of the work that we do here in regards to rehabilitation and short-term rehab. But more importantly, I want to leave you with, Knollwood is a continuing care community. And we work very hard to try to determine what the needs of the community is. Again, most people move into Knollwood in independent living, knowing that as they age in place, they may need different levels of care. And the good thing about it is they don't have to move to another location or another building. They have collaborative discussions with the Knollwood staff. And when they feel that there is a change in their condition and they need more help and services, they make the determination when they want to move to the next level of care. What I will say is Knollwood has a healthy respect for the needs of our residents. We give them autonomy to make decisions about how they want to live their life and how they choose to age in place. And we are a tremendous resource to ensure that they're safe, healthy, living a life with dignity and respect on all levels of care. So we're really proud and happy about the work that we do here. And hopefully there is some information that we're sharing with you today that will help enlighten you about what Knollwood has to offer. However, if you feel the need to make a one-on-one consultation just to learn more based on your own personal needs or preferences, you can feel free to contact us at the Knollwood Sales and Marketing Department. The phone number here is 202-541-0149, and we're here to help you make the decision that Knollwood is the place for you to age in place and to live your best retirement life. I don't know whether or not we have any questions at this time. Alice, do you know if we have any questions? Okay, it says, what are the different admission process between IL, AL, and skilled? That's a great question. And so let me kind of tackle that. I'll tackle the independent and assisted living, and then Dre will share with you what he does to facilitate moving into skilled nursing. So for independent living, the first step is to come in and try to identify what it is that you want. So we usually have a few apartments in inventory that we can showcase. We'll invite you into tour so that you can get an idea as to what we have to offer. For sure, we want to make note and put in our database what your preferences are, whether you want a 1-bedroom, a 2-bedroom, or whatever it is that's going to meet your personal needs. We then determine what we would need to do to get you into Knollwood. Again, the first step to accessing Knollwood is to get on our wait list. The wait list gives you first preference. So let me explain a bit about the wait list, because people ask this question quite a bit. So the wait list, when you fill out your application, you put down your $5,000 deposit, you are assigned a number on our wait list. The number doesn't change. It will never change. However, whatever preference that you want, whether it's a 1 bedroom, a 2 bedroom, a 1 bedroom with a den, or a 2 bedroom with a balcony, whatever your preference or choices are assigned with your number. Whenever any apartments of your preference or your choosing becomes available, we call everybody on the wait list to let them know we have an apartment available that may meet your needs. We offer them the opportunity to come in and tour, take a look. If by some chance they see something they like, they move forward with signing an agreement to move in to Knollwood. I get this question quite a bit. How long is our wait list? And I can honestly say our wait list is as long as short as your needs are. So if we happen to have the apartment that you prefer in inventory and you are on our wait list, we go down the wait list according to chronological order. And the first person on the wait list has the first right of refusal. If they decide it's not the time or it's not quite the right apartment, we move on to the next person until we get the apartment sold. So you may be on the wait list for 6 months, or you may be on there for 1 year. Some people will get on a wait list to affirm a number so that when they're ready, they're at the top of the list. However, whether you decide to not take the apartment at the time, you're perfectly welcome to do so. You will stay on the wait list. Unlike some places, if you refuse 2 or 3 times, they take you off the wait list. We don't do that. If you haven't made a choice within 5 years, they take you off the wait list. We don't do that either. We just really try to work really diligently with the people on our wait list so that we can meet their needs and help them move in to Knollwood. With assisted living, it's all about what you need. So when you come to Knollwood, you'll have a financial assessment and you'll have a physical assessment. You say, why a physical assessment? Because we want to just make sure we're moving you into the right level of care within our community. Not that you can't move in, you just may not be able, we need to move you into the appropriate level of care. Some cases, the physician, your primary care physician may say, Miss Jones really needs assisted living because based on her cognition and clinical changes, I would think that assisted living is the appropriate level of care. And then we adhere to the recommendations of the physician and we offer the Miss Jones an apartment in assisted living. But again, she's still welcome to move in to Knollwood. Again, right now, just so I can share this with you, right now we're running a special for assisted living. We're waiving the entry fee to the end of the year as for a limited time only. And when you move in, you identify what apartment you would prefer, what unit you would prefer to move into, and then we coordinate a date and time for the individual to move in. You're assessed for your level of care. Remember, I said there's 4 different levels of care. We do an assessment to determine what your care needs so we can plan your care plan and services that we'll be providing to you. But Dre will share with you what he does to move people into our short-term rehab and skilled nursing facility.
Yes, for short-term rehab and skilled nursing, the process is slightly different. The vast majority of our rehab patients are coming from an acute setting or for a hospital. So my job is to make sure I maintain relationships with case managers and discharge planners to help facilitate that transfer. Those case managers or social workers will send over clinical information from the hospital directly to us for us to review. We'll take a look at the clinical information to make sure our staff can manage the needs of the patient in the hospital. Our business office will also take a look at the insurance just to make sure we can bill for the services that are going to be used here at Knollwood. From there, we'll communicate whether or not we can admit that person to our facility. If we can, the hospital will arrange transport, get them set up to transfer here to Knollwood. Upon admission, our clinical team, our therapist, and myself all introduce ourselves to the patient, the clinical team, and the physical therapist team, or the therapy team in general, run their assessments, and then from there, we start discharge planning and come up with a plan of care to best suit the needs of the person moving into our community. Every once in a while, we will have individuals who are interested in long-term care here. With that, an application is required, so we'll do a financial assessment. We'll also have our clinical team do a review if they have clinical information. And then one thing we didn't mention earlier, but we also offer respite care. So individuals who coming in for a very short amount of time and just need some 24-hour care for whatever reason, we offer those services as well. So the admission process is slightly different, but at the end, you get the same result. We take a look at your information, make sure it's something we can manage, and then from there, we'll bring you a part or bring you to our community.
Thank you, Dre. That's great information, very helpful, and you summarized that really well. We have one or two more questions. It says, how does prices for remaining at Knollwood change as a resident moves from independent living to a higher level of care? Great question. The only thing that changes is your monthly fee. If you move from independent living to assisted living has 24-hour nursing care, certified nursing assistants that are providing care for you in regard to your activities of daily living, medication management. You have a dietitian, a social worker. So you have a whole team. And then you have a primary care physician that will take care of you here at Knollwood in collaboration with your primary physician in the community. So there's a plethora of services that come with our assisted living. So the price monthly will change as you move from one level to the next. That is the only thing that changed. And there's no entry fee that's required for you to move from independent living to assisted living, because you're now a part of the Knollwood family and community. And we are here to put you in the right level of care based on what your care needs are. So the only thing that changes is the monthly fee when you move from independent living to assisted living. The other is if someone moves into independent living, later require assisted living, must they leave? No. Oh, it said leave their apartment. So if you're moving from independent to assisted living, yes, you would move to the part of the building where assisted living is provided, and it is a different apartment. So you'll be moving into a different apartment, but it would still be an apartment that you chose to move into to get the assisted living services.
Another question that we had is Knollwood primarily for former members of the U.S. military? And a decade ago, that was the case. However, like we mentioned earlier, with Knollwood, we have opened it up to the public. I will say a lot of our community here have some military experience or are a spouse of a military officer, but that is not a prerequisite in order to be able to get admitted here to Knollwood. Again, we've opened our doors to the public. So once you complete the application process and we review your information to make sure you're a good fit, you're more than welcome to join our community.
Well, thank you guys for spending your afternoon with us. I hope the information we shared with you today is helpful. I hope that we brought some clarity to what the requirements or the eligibility is to move into Knollwood. Again, if you have any additional questions or concern and you want to feel the need to have a one-on-one consultation specifically to address your needs and desires, please feel free to reach out to us. You can call us at 202-541-0149 and schedule a tour, an appointment for a one-on-one consultation. Again, thank you so much for joining us today, and we appreciate your support. Have a good afternoon. Bye.